There are certain concepts like corresponding points, anomalous retinal correspondence, eccentric fixation, Horopter, and whatnot. You are also confused? Welcome. Nahi. Hello PGs. Welcome to my channel of Thal Exams and Viva. Today we will be breaking these concepts and will try to understand it in a very easy way, and also we will try to cover exam framework and Viva points for these concepts, like starting from corresponding points to the Panam's area of fusion. So instead of too much of theory, I'll be focusing on diagrams. So remember the concept through diagrams, right? So remember those diagrams and you can reproduce those in exams also. So let's start. Single vision video, there are certain concepts that you should be aware of, very basic points. First, we'll discuss what is binocular single vision, what are its grades, then corresponding points, dividing it into normal retinal correspondence and anomalous retinal correspondence, what is eccentric fixation, how to measure anomalous retinal correspondence, the concept of Horopter, and Panam's area of fusion. Okay, so what is binocular single vision? So you should remember that it is coordinated use of two eyes. So suppose if one eye has this primary gaze, other eye having this primary gaze, and if I want to focus on this object, now both eyes should turn simultaneously to focus on this object, and this should make a single vision in the brain. So this should be perceived as a single image. So it is a coordinated use of two eyes, simultaneous vision with two seeing eyes when an individual fixes his visual attention on an object of regard. So you remember this definition, this diagram, you will be very clear with the concept of binocular single vision. Now, three grades of binocular single vision: simultaneous perception, fusion, and stereopsis. So, what is simultaneous perception? You remember this word: two dissimilar objects. So, power to see two dissimilar objects simultaneous. Like if you see this example of picture of cage to one eye and picture of bird to other eye, if the simultaneous perception is present, it will be seen as bird inside this cage. So when using monoocular microscope, one suppresses the image of the other eye. So this concept is also used in synaptophore machine. So when you see with monocular eyes, these two are different objects, but when simultaneously perceived, these are one, but this is perceived as one image. So next is fusion. Fusion is what? That two almost similar pictures and very much small detail is missing, and that power to produce a composite picture is fusion. So if you see this example of two rabbits either lacking a tail or a bunch of flowers, so if fusion is present, one complete picture is seen, right? Then next is stereopsis. This is nothing but a impression of depth by superimposition of two pictures. For example, bucket. In this picture, it is not similar to depth perception, but it is mainly through fusion of signals from disparate retinal elements, which we'll be discussing later. So you should remember this three grades of fusion with example like this. So I hope the three grades are clear with these three pictures. So remember these three pictures. You can make these three pictures exams, and with simultaneous perception, fusion, and stereopsis. These three pictures clearly explains binocular single vision. Okay, next we come on the concept of corresponding points. Now this part is very important because this is the most acceptable theory for binocular single vision. This is also one of the most accepted theory for binocular single vision, like theory of correspondence and disparity was, but to understand that theory you should know the corresponding points. So for corresponding points we start with this diagram. So you can make this diagram in exams also, in case you have question for binocular single vision and to clear your concepts, right? Retinal elements like this retina, right? Now this F1 is fovea of this eye, F2 is fovea of this eye, right? So which is the nasal part? This is the nasal part of this eye, this is the temporal part of this eye. Similarly, this is the nasal part and this is the temporal part. And suppose this is the object we want to focus upon. So retinal elements of two eyes that share a common subjective visual direction are corresponding points. So easy to remember is that these are pair of points on two retinas. Now let's understand this through diagram. So fovea, we know we have to focus thing on fovea for clear vision. So if suppose I want to see this object, so this eye will turn to this side, right, to see this object, and this eye will turn to this side. Now its image should fall on this fovea and its image should also fall on this fovea, and that's how you get a single vision for this object. So you should remember that binocular single vision is equal to bifoveal vision also you can say. So fovea of one eye is corresponding to fovea of other eye. Similarly, each retinal element has a directional value, right, without which localization is not possible. So suppose that, so you can remember it like this. For example, I say that fovea of this part is corresponding to this fovea, done, F1 to F2. So this will cause single vision. Now whatever part falling on A1, right, it has correspondent part A2 on the in the other eye. So if we see that if suppose it is present 5 degree on the nasal side of this eye, so the corresponding value will be present on the temporal field, temporal retina of this eye. So A1 and A2 are corresponding points. Similarly, B1 temporal part may B1 or either nasal part may B2. These are two corresponding points. So these are very intrinsic corresponding points, and these determines the visual direction, right? So fovea, we take it as the reference point. You can take it as reference point, and based on this we have multiple corresponding points in the two eyes. So image falling on corresponding points give rise to single mental impression for this image. So binocular single vision is due to its retinal correspondence. So you remember this line also. I hope this is clear what are corresponding points. So it said 1 2 3 4 B1. So इसका corresponding point यहाँ पे होंगे 1 2 3 4 B1, right? This how. So एक का temporal area, other का nasal area. So these are corresponding points. So is it clear, right? And rest other points obviously are non-correspondence with its reference. So suppose if image of B1 falls on A2, so these are non-corresponding point. The brain will not recognize this image clearly. So these are two disparate points. So these non-corresponding points are called disparate points, और इसी की वजह से होता है diplopia, right? So it is important that image should fall on the corresponding points of two eyes to have binocular single vision. Rest other points are non-correspondence, and these are called disparate points, which is responsible for double vision. So what is the clinical importance of this corresponding point? That it makes the basis of binocular single vision and helps in understanding diplopia and squint. So now let's see what is normal retinal correspondence and what is anomalous retinal correspondence. So what we just studied was normal. What is normal? One eye has image on F1 and other eye has image on F2 on its normal corresponding point. So this is normal corresponding point. So this is normal retinal correspondence. Now suppose if the patient has small angle deviation, so this eye is little deviated inside, So instead of image falling on F2, the image is falling on the nearby point, some extrafoveal point. What will the brain perceive? That every time this F1 is corresponding with this extrafoveal point. So what will brain do? That brain will make this extrafoveal point, equivalent to this F2. So whenever the image is falling on this point also, maintain the binocular single vision. So brain normally क्या होना चाहिए था? F1 and F2 पे if image is falling, there should be binocular single vision and no diplopia, right? But if the image is falling on E instead of F2, so what will happen? These are two disparate points, so diplopia will happen, right? Now to control this diplopia, what will brain do? Because it is a very small angle of deviation and growing cortical connections, so brain will give power to this extrafoveal point to act as foveal point for some time, right? So this will maintain binocular single vision. Despite of having manifest squint, he is maintaining binocular single vision because of anomalous retinal correspondence. Now let's understand with this word. So this is functional adaptation, right? This is a functional adaptation. At what level? Cortical level पे हुआ है to very small angle squints, only for very small angle squints which are less than 4 degrees squint, with change in synaptic connections, that instead of giving whole power to F2, some extra power, some similar power is given to this extrafoveal point. This is mainly done for small angle squint. Remember this word, this is very important for this thing. So extrafoveal point is close to fovea, and this is how it is maintaining binocular single vision even in manifest squint. So how do you break it? So when you see with both, when this patient will see with both the eyes open, so this will be perceived as binocular single vision. Now suppose if I block this eye, so I close this normal eye, so what will happen? Now this eye knows, so brain knows that to focus on this object, fovea is the best place to fall the image on. So now the eye will take its primary position and the image will now fall on the fovea only. So I will refixate and comes back to primary position. So this is mainly in the case of small angle squint deviation, right? तो जब दोनों आंखों से देख रहा था तो F1 E के साथ मैनेज कर रहा था, बट जैसे ही मैंने F1 को क्लोज किया, so F2 वापस पावर में आ गया, right? So you understand now? So when you close the normal eye, the extrafoveal point जिसको पावर दी थी बाहर, it loses its advantage and eye refixates in primary position. You remember to this point very closely because this is very important, and later we will differentiate it with eccentric fixation also, right? Now this ARC is common in esotropias, then exo and then vertical squints, so mostly for eso. So if I ask you about the what are the prerequisites for anomalous retinal correspondence, that number one, age. Obviously it should be a young age when the synaptic connections are made. So that is less than 2 years, and early onset squint mein this will happen. Then the deviation is constant and small angle deviation is there up to 4 degrees, or you can say 8 prism diopters, and it is only in the one eye. That is when anomalous retinal correspondence will be there, right? So there are small angle squint, extrafoveal point, on closing one eye refixates with the fovea, right? Less than 2 years may having synaptic connections, constant small angle deviation in unilateral eye. These are very, very, very important points to get the concept of anomalous retinal correspondence clear. I hope I'm able to explain you some part of it. Okay, now let's discuss about eccentric fixation. So anomalous में क्या था? So anomalous में we just discussed प्लीज मेरे डायग्राम्स पे मत जाना, right? So image on f1 when seeing with both the eyes, so instead of falling on f2, extra foveal point has this power. So जब मैंने इसको block किया, so this power is given back to the fovea point and the eye will take its primary position. But what if it is like Game of Thrones कि मैंने इसको power, मैंने foveal power extra foveal को दिया था, but now he has taken over the kingdom. Now he is not giving back it to fovea, right? Then it becomes eccentric fixation. So you remember that in eccentric fixation, the extra foveal point is now the new fovea for that eye. So when fovea of the other eye loses its property of primary visual direction and is taken over by extrafoveal point, then it is eccentric fixation. Now what will happen? So when we are seeing with both the eyes, so this image will fall on extrafoveal point, right? So if we close this eye, so what will happen? Now this eye was supposed to take its primary position, supposed to refixate and f2 को power में वापस आना था, but now the extrafoveal is the new king and that's how there will be no movement. So on closing normal eye, squint eye does not correct to the primary gaze. Now this has become eccentric fixation, that foveal extrafoveal connection has been set up. So another word you need to remember is, now here we have foveal extrafoveal connection, permanent connection. Okay, so this is eccentric fixation, and this is how you differentiate between ARC and eccentric fixation. This will refixate on closing the normal eye, this will not refixate, right? The extrafoveal point is become the new fovea for this eye. Now, how do you measure anomalous retinal correspondence? Now, we have already discussed the test to measure angle deviation. We discussed this video. If you have not seen that video, please go and watch that video for easy understanding of my upcoming videos, right? So we divided it into objective test and subjective test, or I should say these are like motor test and these were like sensory test. So with sensory test you get subjective angle, and with objective test you get objective angle of deviation, right? So these are the subjective tests: synaptophore with bird and cage picture, Worth-4 dot test, Begolini's, Maddox rod, after image, red filter test, and there is something known as foveal test of cuppers, mainly to rule out eccentric fixation or to see for it, right? For objective test you use prism bar cover test, cover uncover test, और synaptophore से तो आप कुछ भी कर सकते हो. Here we use alternate on and off test to look for objective angle. So if angle of deviation, you remember this, that angle of anomaly A, right? ये कुछ नहीं है. Angle anomaly is equal to objective angle minus the subjective angle, right? So if subjective angle is 0, if it is 0, so angle of anomaly is equal to objective angle. कि angle of deviation is equal to objective angle. So motor maintain हो रहा है, sensory ऐसा कुछ नहीं है. So this is called harmonious anomalous retinal correspondence. Now if suppose subjective angle is not equal to 0, then the objective angle is more than angle anomaly. So this is non-harmonious ARC. So even the ARC is of two types, harmonious and non-harmonious, based on your test. Now for example, suppose मैंने objective test किया PBCT, यहाँ पे मेरा ठीक है, PBCT में suppose my angle has come 25 prism diopter, and suppose sensory में मेरा आंसर आया 15 prism diopter, है ना, मैंने angle of deviation measure किया. So now what will be the angle anomaly? So you minus objective angle minus subjective angle, so you minus 25 minus 15, so it is like 10. So it is equal to objective. This is angle of anomaly, right? And this is objective angle. So what was, so angle of anomaly is 10 prism diopter, right? And my objective angle was 25 prism diopter, and subjective angle was not equal to 0, and this is more than this. So what is this? This is non-harmonious ARC, and this is how you calculate. So if suppose on subjective angle there is no squint, but on objective test squint is coming, so that is a harmonious ARC. But now if on subjective test some amount of squint is there, even on objective test this more, the angle deviation is less and the objective angle is coming more, it is non-harmonious ARC. On to what is Horopter. Now Horopter, remember this is horizon of vision. So it literally means horizon of vision, right? It was introduced by Ugolinius. So if all the corresponding points, this eye also of corresponding points of this eye also, now they are projected into space at any particular distance, so it forms a plane. बनाएगा ना कुछ plane, ये यहाँ से इसका ये corresponding, ये corresponding, right? So ऐसे corresponding point करके ये एक plane बनाएगा, and this plane is called Horopter. Now there's something known as geometric Horopter, the theoretical Horopter. ऐसा कुछ, that what does it say? That you make a circle passing through corresponding points of two eyes, right? So these are the corresponding points of two eyes and you make a circle. This is known as Viethmuller circle. But in practice, this is not a circular Horopter. You have a more flattened Horopter, and this is called actual Horopter, or we call it empirical Horopter, right? So this is empirical Horopter curve. So it is not curve, it is more flatter. जबकि Viethmuller circle is a theoretical circle passing through corresponding points. The deviation between geometric Horopter and actual Horopter. So this deviation between the two Horopters is called Herring-Hillebrand deviation, HH, Herring-Hillebrand deviation, right? So you remember this diagram. This diagram explains geometric Horopter, corresponding points, empirical Horopter, and Herring-Hillebrand deviation. This is, I just made the reference line just to explain. So Horopter is with reference to our point of fixation and it can vary. So what is Viethmuller circle? So you remember that it is a geometrical theoretical Horopter which is constructed by drawing a circle passing through corresponding points of two eyes, that is Viethmuller circle. What is actual Horopter? That actual Horopter is flatter than theoretical Horopter and the shape varies person to person. What is Herring-Hillebrand deviation? The difference between actual and geometric Horopter is called Herring-Hillebrand deviation, right? So this is clear. Now let's come to Panem's area of fusion diagram. So this is the same diagram. It is just, I will explain that very small areas around the corresponding point. Suppose this is my corresponding point fovea and very small points around this corresponding point can still be fused singly. So this point still can be fused. So this will create some area, right? Like this part when you make Horopter. So despite the disparity, there is no diplopia in this region, and this is called Panem's area of fusion, right? And this is the area which is responsible for physiological basis for depth perception. So this is responsible for depth perception. So Panem is smallest at the fixation point and it will just increase sidewise, right? Depending on the retinal eccentricity. Okay, so this is Panam's area of fusion responsible for physiological diaphragm. So you remember this diagram and you can always clear your concept of Horopter. Now the Horopter comes in as short note also. This is very important as in Viva also. So you should be very clear about this picture in your mind, and you can always talk about it, and you just cannot stop talking about it, because you can talk about corresponding points, with Muller circle, empirical Horopter, Herring's deviation, Panam's area of fusion, physiological basis for depth perception, and this is like Horopter, it is complete. So okay, so today we have very nicely cleared certain concepts. Before we proceed further, binocular single vision definition, and mainly three grades. So for three grades, you remember those three diagrams, you can always mention, and you can always remember for clarity: fusion and stereopsis, right? And these grades are always asked in Viva and always a part of long answer question. तो इसमें आप वो डायग्राम बनाइए that I have shown you and complete your answer. Corresponding points, I hope it is clear now. Then after writing definition of corresponding points, making that diagram I showed you, you write about normal retinal correspondence, anomalous retinal correspondence, divided into harmonious and non-harmonious based on the test you can mention here. Eccentric fixation, I hope it is now very clear. This you can divide it with subjective test and objective test, and you can measure angle deviation, right? Horopter ke liye I have given you diagram. You can explain everything with what is with Muller circle, what is empirical Horopter, Herring deviation, and Panam's fusional area, right? So you can talk about it now. So Panam's area of fusion, right? This is done. I hope this is clear. You are good to go. These may look like theoretical concepts and very small things, but this makes foundation for your binocular single vision and squint for further video. So watch this twice or thrice and revise it. And subscribe for more structure. Further build on binocular single vision and squint. तब तक के लिए ऑप्थेल्ला